February 14th is the World Epilepsy Awareness Day. It is important to know that epilepsy is a medical disease that should be diagnosed early, and if treated early, we can control the epilepsy. In good number of patients, we can even provide the cure. There are certain types of epilepsies which are also caused not only by an electrical disturbance or due to structural abnormalities in the brain or a distinct lesions within the brain. These structural abnormalities can happen during the birth due to lack of oxygen or lack of sugar in the blood. They can produce a scarring inside the brain tissue. We call it as medial temporal sclerosis. And this is something, if it is diagnosed early, treated early, initially with medicines, and if not controlled, early surgery can completely cure the epilepsy. Similarly, there are many structural lesions that can trigger epilepsy. That includes all varieties of tumors. Particularly in children, there are certain specific tumors which arise from the very sensitive epileptogenic areas called medial temporal lobes, and these tumors are removed and they can have a good control of epilepsy. There are vascular malformations such as cavernomas, which present recurrent bleeds and epilepsy, arteriovenous malformations which also cause epilepsy, and there are certain tumor-like conditions that can also produce epilepsy. When we do an MRI scan in the brain, we can identify all these structural abnormalities, and these structural abnormalities initially can be tried with medicines, and in spite of that, if the epilepsy continues, early decision to operate will definitely help, and we will be able to control the epilepsy completely. The abnormal area of the brain will get corrected once we remove the abnormal tissue. It could be a scar, or it could be a tumor, or it could be a cavernoma. Once it is removed, and the trigger of the epilepsy itself is stopped. Afterwards, we will continue the medicine at a very low dose for a while, and then can be stopped. There are certain special surgeries which have been possible now with the advent of modern technology, and even during the surgery, we can confirm the origin of epilepsy by placing the electrodes directly onto the brain and getting the recording done.